Everyone, it's Dr. Jeff here again. Thanks for joining me. This month at the Goldsworthy Chiropractic Wellness Center, our theme of the month is on heart and stroke. I'm sure at some point this month you'll end up having someone knocking your door looking for donations for Heart and Stroke Foundation. Heart attack does remain the #1 cause of death in Canada. More prominent this time of year because when you go out in the cold, your arteries constrict and your heart has to work much harder at getting blood out to your limbs, and that's why you get so many people going out to shovel snow and they actually have a heart attack. So it's very important when you have a heart attack that you get medical attention right away. The average wait time to go see the hospital for a heart attack victim is 2 hours in Canada. That's too long. The sooner you can get in, the sooner you can actually get some medication to actually reduce the damage done by the heart attack. So it is important that if you have any signs or symptoms of a heart attack, you seek medical attention right away. So what kind of things would you be looking for? Well, one would be excessive sweating. So for unexplained reasons, you don't know why. Some people have the classic signs such as chest pain or indigestion. You just don't feel very well. Classically up into the shoulder, you get some pain that may go down the arm. These types of things. Other things you may be looking for would be abdominal discomfort or weakness, or you just don't feel right. Those would be signs of a heart attack. If you have any of those signs at all, it's important that you get checked out. Don't wait and thinking it's going to go away. It's important that you get checked out right away. As far as a stroke is concerned, a stroke is more about a blood clot in your brain. So these things would lead to some sort of paralysis or dizziness. You get a headache that you just don't understand why. It's very intense. You may have some numbness down the arm. Again, if you think of someone's having a stroke, there's 3 things you want to do with them. One is you want to get them to smile. Because they smile, because of the paralysis, one side's not going to go up. You may ask them to talk because they're going to be confused. They're not going to be able to get the words out. They'll be mumbling. Other things you make them do is try and lift their arms up, because they'll lift one arm up because the one side's a little paralyzed. They won't be able to get that arm up as high. So again, if you're suspecting a stroke, it's very important that you get, you try these 3 things, and even if one is positive, you want to seek medical attention right away. Don't wait. Because again, today they have lots of clot-busting drugs that can get in there and reduce the damage done by the stroke or the heart attack. As far as chiropractic is concerned, heart attacks, the nerve that makes your heart rate actually speeds up is called the vagus nerve. It actually comes from your neck and goes to your heart. The one that actually, that's the one that slows it down. The one that actually speeds it up actually starts at T2, which is right below the big bump back in here. That actually speeds your heart rate up. Usually people that have had heart attacks usually come in and they're very tight in the upper back or they have a very stiff neck. And this is something chiropractic actually helped to reduce some of that tension. I actually had a patient one time that came in and he'd already had a heart attack once, and he came in, he wasn't feeling all that well. When I actually palpated him and talked to him, his upper neck and his headache, or his heart attack spot between his shoulder blades was very, very sore. And I said, you got to get to the hospital right away. So we shipped him off right away. He was very happy we did that, because sure enough, he was suffering from a second heart attack. And they got him there early enough that they could give him the clot-busting drug to actually limit any damage to his heart. So if you have any of these symptoms, it's very important that you get to the hospital. Acupuncture, a point called PC6, which is actually a vagus nerve point, has been found by research to be very beneficial for people after they've had a heart attack to actually regenerate some of that damaged heart tissue. So that's something you talk to an acupuncturist about. So again, if you are suffering from any symptoms that you think you're suffering from a stroke or a heart attack, we recommend you get to the hospital as soon as possible. Yeah. I'm Dr. Jeff. Thanks for listening. If you like my video, share it with people.